Epilepsy is a common neurological condition in dogs, and this study investigates the use of high-field magnetic resonance imaging, MRI, to identify structural causes of epileptic seizures in dogs that have a normal neurological examination between seizures. Previous research in this area has been limited, particularly regarding the use of high-field MRI. This research aims to address this gap by reporting on MRI findings in a large group of epileptic dogs with normal inter-ictal neurological exams, to determine how common structural disease is in this population, and whether there are associations between signalement, seizure type, and the presence of structural disease. The worldwide lifetime prevalence of active epilepsy in humans is approximately 0.76%, affecting about 50 million people. In dogs, it is estimated that 0.82% will experience at least one epileptic seizure event, and approximately 0.62% of dogs attending primary care practices in the United Kingdom are diagnosed with epilepsy of unknown origin. In the UK, with an estimated 11 million dogs, this translates to over 90,000 dogs having a single epileptic seizure in a one-year period, and 68,000 diagnosed with epilepsy of unknown origin. Consequently, epileptic seizure disorders are the most common neurological complaint in dogs, and are regularly seen by most small animal clinicians. Epileptic seizures can result from several different disease processes, such as metabolic or toxic causes, reactive seizures, structural issues, and idiopathic causes including genetic, suspected genetic, and unknown origins. The International Veterinary Epilepsy Task Force, IVETF, recommends that dogs under 6 months or over 6 years of age at their first epileptic seizure should undergo brain MRI. An abnormal inter-ictal neurological exam is associated with an increased risk of structural disease causing seizures in dogs. However, IVETF recommendations on imaging based on age are regardless of the findings of the inter-ictal neurological exam. These guidelines were based on studies that suggested a statistically significant increased risk of a structural lesion outside of these age limits, but some of the studies did not differentiate between dogs with normal or abnormal inter-ictal neurological examinations or did not require reliable neurological examinations at all. Some studies also included dogs with neurological abnormalities in the neurologically normal population, such as changes in mentation, cervical hyperesthesia, postictal changes, and abnormalities likely due to anti-seizure medications. While some studies reported high incidences of structural disease, if dogs with abnormal neurological exams are excluded, the incidence of structural disease varies from 5.3% to 31%. Furthermore, many of these studies had small patient populations, which become even smaller when only neurologically normal animals are included. It has been found that the risk of structural lesions increases outside the age range of 6 months to 6 years. A recent study of 900 dogs undergoing MRI to investigate recurrent seizures found a statistically significant association between idiopathic epilepsy and the patient age group between 6 months and 6 years. In that study, 70.9% of dogs over 6 years old had structural lesions, while only 3.4% of dogs under 6 months did. The availability of high-field MRI may allow for the discovery of more subtle lesions due to the improved spatial and image resolution compared to low-field scans. Additionally, earlier lesions may be discovered, particularly considering how IVETF recommendations may affect which animals undergo MRI scans. The IVETF also recommends MRI scans in all patients that experience cluster seizures or status epilepticus. One study reported 41% of dogs diagnosed with idiopathic epilepsy presented with cluster seizures, and 10% presented with status epilepticus. Other studies have documented idiopathic epilepsy as the cause of 40.3% of cluster seizures, and between 13.2 to 37.5% of status epilepticus. However, none of these studies assessed the risk in patients with a normal neurological exam who had not yet been diagnosed with the cause of their seizures. Therefore, it is not clear whether cluster seizures or status epilepticus increase the risk of structural disease in this patient group. Brain MRI is a significant financial cost and requires general anesthesia or heavy sedation, which can be risky. Additionally, the availability of this imaging method can be limited depending on location. As pet owners are increasingly demanding diagnostic tests that are specific to each patient, there is a need for updated and accurate information on the diagnostic utility of brain MRI in epileptic patients with a normal neurological examination. This study was designed retrospectively. The study searched digital medical records from the University of Liverpool Small Animal Teaching Hospital from December 2008 to May 2024 for dogs that presented for the investigation of epileptic seizures. The study included dogs that had complete medical records and experienced more than one seizure event more than 24 hours apart. The dogs also had to undergo a full neurological examination by a specialist in veterinary neurology, have had a brain MRI, and had metabolic and toxic causes of seizures ruled out through clinical history and blood work. Dogs were excluded if a complete neurological exam was not possible, if any abnormalities were found on neurological exam, if it was not clear if seizures or other paroxysmal events were responsible, if the history was consistent with neurological abnormalities other than epileptic seizures, and if medical data or MRI data were not available for review. The University of Liverpool Veterinary Research Ethics Committee approved the study. The study collected information on signalement, clinical history, neurological exam findings, clinicopathological findings, MRI findings, treatment, outcome, and follow-up information from the records. Breeds were recorded individually, and purebreds were grouped by skull conformation type. For statistical analysis, breeds with more than 10 animals were analyzed separately, and all other dogs, including crossbreeds, were grouped together. Dogs were grouped by age at the time of their MRI and at the onset of seizures using the following categories: less than 6 months, 6 months to less than 1 year, 1 year to 6 years, 6 to 8 years, and greater than 8 years. Seizure types were grouped into generalized seizures only, focal seizures only, and both generalized and focal seizures, including cases of focal seizures with secondary generalization. The presence of cluster seizures, more than one seizure in a 24-hour period, and status epilepticus, a single seizure lasting more than 5 minutes or 2 seizures without regaining consciousness in between, were also recorded. Cerebrospinal fluid (CSF) analysis was evaluated when available but was not required for inclusion in the study. The MRI images were acquired from December 2008 to July 2015 with a 1.0T MRI scanner and from August 2015 to May 2024 with a 1.5T scanner. Since the 1.0T scanner is a superconducting magnet, all images were considered high field. Imaging sequences included T2 weighted images, T2W, in transverse and sagittal planes, fluid attenuation inversion recovery, FLAIR, and pre- and post-contrast T1 weighted images, T1W, in the transverse plane. The images were reviewed by a board-certified diagnostic imager and a board-certified or residency-trained neurologist. Periictal change was diagnosed by the presence of bilaterally symmetrical T2W/FLAIR hyperintensity in the hippocampus, piriform lobes, and cingulate gyri. CSF collection was performed under the same general anesthesia and analyzed for red blood cell (RBC) count, total nucleated cell count (TNCC), protein concentration, and cytological examination with the differential cell count. Normal CSF TNCC was defined as less than 5 cells/L, and normal CSF total protein was less than 0.45 g/L. Descriptive statistics were performed using Excel, and statistical analysis was performed using SPSS software. Continuous data were assessed for normality using the Shapiro-Wilk test, and normally distributed data are presented as range and mean values, while abnormally distributed data are shown as range, median value, and interquartile range, IQR. Binary logistic regression modeling was used to evaluate the associations between risk factors and structural abnormalities on MRI. Variables were assessed for correlation using Spearman's rank correlation coefficients, and if the coefficient was greater than 0.8, the most statistically significant or biologically plausible variable was selected. Independent variables with a liberal association, p less than 0.2, were taken forward for multivariate modeling, with statistical significance set at p less than 0.05. 416 dogs met the inclusion criteria, but 4 were excluded from analysis because the results of their MRI could not be definitively categorized as either causative or incidental, resulting in a study group of 412 dogs. Crossbreeds were the most commonly affected, 15.3%, followed by Border Collies, 9.5%, Labrador Retrievers, 6.3%, and Cavalier King Charles Spaniels, 4.6%. There were 98 brachycephalic dogs, 23.8%, 214 mesocephalic dogs, 51.9%, and 39 dolichocephalic dogs, 9.5%. The study included 131 females, 31.8%, 64.9% of which were neutered, and 281 males, 68.2%, 62.3% of which were neutered. The median age at diagnosis was 51 months, and the median age at the first seizure was 40 months. The distribution of dogs by age at diagnosis was 6% less than 6 months, 6.3% between 6 months and 1 year, 61.7% between 1 year and 6 years, 16% between 6 and 8 years, and 12.4% over 8 years. The distribution of dogs by age at first seizure was 6.1% less than 6 months, 10% between 6 months and 1 year, 62.1% between 1 year and 6 years, 12.4% between 6 and 8 years, and 9.5% over 8 years. Of the dogs in the study, 236, 57.3%, had MRI performed with the 1.5 T magnet, and 176, 42.7%, with the 1 T magnet. 76 of the 412 dogs, 18.4%, had abnormalities detected on MRI, and 60 of those abnormalities, 78.9%, were considered to be incidental. Incidental findings included Chiari-like malformation, 50%, otitis, 33.3%, syringohydromyelia, 21.7%, ventricular dilation, 10%, periictal change, 8.3%, mild cortical atrophy, 6.7%, atlantoaxial band, 5%, absent septum pellucidum, 5%, mild supraclavicular fluid accumulation, 3.3%, and various other single occurrences such as caudal calvarial malformation, ear mass, vascular malformation in the fourth ventricle, dental disease, atlantoaxial band, pterygoid muscle lesion, and temporal muscle lesion. 16 dogs, 3.8%, had clinically significant structural changes on MRI. Of these, 81.3% were suspected neoplastic, 9 suspected gliomas, 2 meningiomas, 1 suspected histiocytic sarcoma, and 1 calvarial mass. 12.5% were anomalous, 1 cortical dysplasia and 1 porencephaly, and 6.3% were inflammatory, meningoencephalitis of unknown origin. The breeds affected by structural lesions included 4 Staffordshire Bull Terriers, all gliomas, 4 Border Terriers, all gliomas, 2 crossbreeds, 1 Old English Sheepdog, 1 French Bulldog, 1 soft-coated Wheaton Terrier, 1 Boxer, 1 miniature Poodle, and 1 English Bulldog. When the dogs were split into age at diagnosis groups, the structural causes of epileptic seizures were distributed as follows: 0% in dogs less than 6 months old, 0% in dogs between 6 months and 1 year, 6% in dogs between 1 and 6 years, 3 neoplastic and 1 anomalous, 4.5% in dogs between 6 and 8 years, 2 neoplastic and 1 inflammatory, and 17.6% in dogs over 8 years of age, 8 neoplastic and 1 anomalous. When split by age at the first seizure, the distributions of structural causes were 0% in dogs less than 6 months, 0% in dogs between 6 months and 1 year, 1.6% in dogs between 1 and 6 years, 3 neoplastic and 1 anomalous, 5.9% in dogs between 6 and 8 years, 1 inflammatory and 2 neoplastic, and 23.1% in dogs over 8 years of age, 8 neoplastic and 1 anomalous. The median time between the onset of seizures and diagnosis was 2.5 months overall, but only 1 month in the structural group. Most patients with a structural cause had experienced seizures for 2 months or less, though 2 patients had seizures for 6 and 20 months. 68.7% of dogs had generalized seizures, 16.5% had focal seizures, and 14.8% had both generalized and focal seizures. 42.1% of dogs had a history of cluster seizures, with 10/16 dogs with structural disease and 164/396 dogs without structural disease having this history. Status epilepticus was recorded in 33 dogs with 4/16 dogs with structural disease and 30/396 dogs without structural disease having this history. CSF was sampled in 274 dogs, and was abnormal in 20, but blood contamination precluded meaningful analysis in 7 of those cases. The remaining 13 cases had abnormal CSF results, and blood contamination was determined to be the cause in 2 of them. The remaining 11 dogs had an increased TNCC, and all were diagnosed with idiopathic epilepsy. Abnormal protein concentrations were reported in 4 dogs, and 1 of those dogs had a structural cause of their epilepsy, porencephaly. The Spearman's rank correlation coefficient between age at diagnosis and age at first seizure was 0.847, so only age at first seizure was included in the logistic regression model. Univariable analysis showed that breed, age at first seizure, the presence of cluster seizures, and the presence of status epilepticus were associated with a diagnosis of structural disease. At the multivariate level, only age at first seizure and a history of status epilepticus remained significant. The risk of structural disease increased with increasing age group at first epileptic seizure, and a history of status epilepticus was also associated with an increased risk of a diagnosis of structural disease. The study found that only 3.9% of the 412 dogs with a normal inter-ictal neurological exam had a structural cause of their seizures, which is less than previously reported. Structural disease was more common in older dogs. Specifically, no dogs under 1 year of age had a structural cause of their seizures. The proportion of patients with structural disease increased from 1 year of age, with patients over 8 years having the highest proportion of structural disease, 23.1%. This is consistent with previous studies that found older animals with a normal inter-ictal neurological examination are at increased risk of structural disease. However, within this study, the risk of structural disease in dogs over 6 years of age was 13.3%, which is less than the previously reported 26.7% in dogs over 6. This likely reflects the more rigorous exclusion of dogs with inter-ictal abnormalities in this study. Full neurological examination cannot exclude significant structural disease, particularly in silent areas of the brain such as the olfactory region and piriform lobes. The most common structural lesion in this population was neoplasia, affecting 81.3% of patients with structural disease. Slowly progressive diseases such as slow-growing neoplasms may be difficult to detect clinically, since the brain can adapt to slow changes. These diseases are more likely to affect older dogs. It is also important to appreciate that most dogs over 8 years of age in the study were diagnosed with epilepsy of unknown origin. This suggests that geriatric-onset epilepsy is common in dogs, and that it should not necessarily result in a guarded prognosis in neurologically normal animals. Although it is sensible to discuss the merits of MRI in older dogs due to the risk of clinically silent structural lesions, most of these patients will have a normal scan. The study found that a normal neurological examination cannot completely exclude significant structural disease. Within the study, Border Terriers, 33.3%, and Staffordshire Bull Terriers, 22.2%, had a higher percentage of structural lesions, all of which were suspected to be gliomas. These breeds were among the top 3 most common breeds with interaxial neoplasia in another study that examined the cause of seizures in 900 dogs. Another study recommended that all boxer dogs that experience epileptic seizures undergo an MRI due to the high prevalence of structural disease in this breed, although there were only 6 boxers in the current study, and only 1 had a structural lesion. A history of status epilepticus was also associated with an increased risk of structural lesions. It is possible that diagnostic yield of performing MRI for the investigation of epileptic seizures may therefore be greater in patients that are older at the onset of their epileptic seizures and have experienced status epilepticus. Incidental findings were relatively common, with 14.6% of patients having abnormalities not expected to cause epileptic seizures. The use of high-field MRI in the study, compared with previously used low-field studies, may result in increased confidence in differentiating incidental from causative findings. However, It is also possible that smaller anatomical variations may be better visualized with 3T or super high-field MRI. This study had a retrospective design, which prevented individual case follow-up. Also, microscopic disease could not be excluded. Although the MRI protocol was consistent throughout the study, many patients did not have CSF analysis, and CSF abnormalities can be secondary to the seizures themselves. The diagnosis of seizures largely relied on owners' descriptions of events. Also, electroencephalography, e.g., was not performed in any cases, so cases of other paroxysmal events such as paroxysmal dyskinesia cannot be excluded. Paroxysmal dyskinesia is being increasingly recognized in veterinary neurology, and because it is not generally associated with structural disease, this may have falsely lowered the percentage of animals with no structural lesions on MRI. It was concluded that better testing may be needed to distinguish different types of events. Although frequently reported to be feasible in practice, few centers routinely offer EEG as part of the epileptic seizure workup. The study concluded that epilepsy of unknown cause is the most common cause of epileptic seizures in dogs with a normal inter-ictal neurological examination, regardless of age. Although a normal neurological examination cannot completely exclude significant structural disease, most animals with seizures and a normal inter-ictal exam will have a normal MRI scan. The age at diagnosis and the presence of status epilepticus were associated with an increased risk of a structural lesion. Therefore, it may be pertinent to consider risk on a patient-by-patient basis when recommending MRI. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.